Locus is? I don't mean a little flying insect. What do I call that? Shalabhasana. Shalab. A locus is a place, a location in some language, Greek maybe, where the voluntary and the involuntary functions come together. So, when we have, out of the way. I take the reserve to be impolite because I can't stand myself right now. If this, we were talking about the sympathetic and the parasympathetic nervous systems. Does everybody know what the sympathetic nervous system is? Well, okay, so let's start with that. The autonomic nervous system, which Devagyano is talking about, can you see this?
No. Can you put it in the middle of the room?
No, that would be unfair. I should know what I'm talking about. So autonomic means of its own name. Has two aspects to it. The sympathetic nervous system, and the name goes against what it really does. The sympathetic nervous system is the fight or flight. The one that secretes epinephrine. When you're scared, you go, ha! And you're excited. That's the sympathetic nervous system. It increases the blood flow to the muscles. It dries out the skin, or it makes the skin sweat. The heart rate goes up. People tremble. You follow that? Sometimes they vomit, and sometimes they have diarrhea when the sympathetic storm happens. Okay? You got that? If you suddenly see a bear in your bedroom or something like that, you go, no! And then that's the sympathetic. So the autonomic nervous system consists of the sympathetic, and it's really not simpatico, that nervous system. It's very unsimpatico, so don't ask me why they call it that. Or you can ask. Anybody want to ask? No, okay.
Change the word.
Just change this, the unsympathetic nervous system. Okay? The other one is called the parasympathetic nervous system. I got a C in Hebrew handwriting. That was my first C in 3rd grade. The parasympathetic nervous system, it's not funny, consists of that part of your nervous system which slows you down. I am doing sadhana. I am calm. I am a yogi. Okay? So the bowels work nice and smooth. The heart slows down. The skin gets dry. And you feel calm. And you're not shaky and jittery. You need both of those nervous systems to function. And Anandamarga sadhana depends on both of these. Have you ever seen, back when I was a young'un, people didn't used to, even some Shivananda, we didn't used to just sit there. We would go, and jump up and around until some acharya said, don't do that, it's distracting. And then they stopped. But for a long time, everybody was going, having the kundalini rise and, occult symptoms and falling over and stuff. Now they're usually pretty quiet about it. You just fall over. I don't know what the deal is. Sometimes they jump. Have you seen this?
Yeah.
Okay. That's not parasympathetic. That is not a relaxed form of sadhana. Tantra is not a relaxed form of sadhana. Okay, that's why I shouldn't say this. I'll say it. That's why we don't live as long as the transcendental meditation people. Okay, this is not that kind of sadhana. The TM guys have a very sympathetic, or a very parasympathetic, it calms them down. They have a mantra that doesn't mean anything. It does, that's what they say. Sometimes they do, sometimes they don't. The meanings. And, they have got results, and they do stuff. We'll explain. When the TM guys do it, and maybe some other disciplines, they have shown that there is entrainment of the brain waves from one part of the brain to the other, whereas normally they would be different. Okay? And they've even shown entrainment between one person and the next person. Isn't that cool? So that's part of their deal. Now, they don't just do the parasympathetic either, because when they get into their more advanced stuff called the Siddhis course, they start flopping around the room. Okay, so even they have got something. Maharishi's not a slouch. Okay, so the parasympathetic nervous system is guided by what nerve?